Hi guys, welcome to my channel once again. So today we are going to look at frozen shoulder versus rotator cuff injuries. How to tell the difference. Okay? Have you ever been paralyzed by a sharp, relentless pain in your shoulder, leaving you to ask, why is this happening to me? Well, if this is your case, pay attention. I'll discuss everything for free. Shoulder pain doesn't just inconvenience you, it can completely derail your day-to-day activities. Now, pinpointing the cause of this discomfort is essential to reclaiming your life back. And the two primary offenders often to blame are frozen shoulder and rotator cuff injuries. I'm your host, Chinedu Obai, your favorite online physiotherapist, all fostering a community of knowledge and support. Learn, heal, and recover. Join me as we explore the crucial differences between these conditions and discuss the most effective treatments to get you back to living pain-free. Understanding frozen shoulder. So I'll discuss the causes and symptoms. Okay? So what exactly is a frozen shoulder? All right. Also known as adhesive capsulitis, is a condition where your shoulder becomes incredibly stiff and painful. This stiffness doesn't happen overnight. It progresses through three stages. Freezing stage. This is gradual increase in shoulder pain. 2. Frozen stage. The shoulder becomes stiff and you have difficulty moving it. Okay? 3. Thawing stage. The stiffness slowly goes away and movement gets easier. Alright? Now let's look at the symptoms of frozen shoulder. Shoulder pain that gradually worsen can be concerning. So it often extends to the upper arm and intensifies at night, disrupting sleep and daily activities. So stiffness and restricted motion may occur, making tasks like reaching or lifting challenging and significantly impacting the quality of your life. Okay? Causes of frozen shoulder. The causes of frozen shoulder, such as pain, are varied. In some cases, it develops within an obvious reason, leaving the sufferer or you puzzled about its origin. Okay. However, after observing and treating many cases as a physiotherapist, certain health conditions like diabetes and thyroid problems, as well as periods of immobility after surgery or injury, have been linked to shoulder issues. Okay, let's look at rotator cuff injury, symptoms and types. All right, the rotator cuff is a group of muscles and tendons that keep your shoulder stable and allow for a wide range of movements. Okay, so without your rotator cuff muscle, some shoulder movement will be impossible. All right, so injuries here usually involve tears or inflammation and can be classified into acute and chronic. Acute injuries. This occurs suddenly, such as when you lift something too heavy or experience a fall. Yeah, or experience a fall. Okay, chronic injuries. Chronic injuries develop over time from repetitive motions or general wear and tear due to overuse of a particular body parts. All right, let's look at the symptoms of rotator cuff injuries. Pain when lifting your arm, especially above your head, okay, weakness in your shoulder, limited range of motion, pain that can be worse at night. All these are basic or specific symptoms of rotator cuff injuries. Okay, causes. Some causes of rotator cuff injury include repetitive motions in activities or sports, sudden injuries, aging and degeneration, or poor shoulder mechanics. Okay, now since our focus is on frozen shoulder versus rotator cuff injury, let's take a look at the key differences between frozen shoulder and rotator cuff injuries. Okay, so how can you tell the difference between a frozen shoulder and a rotator cuff injury? I'll tell you this for free. Number one, onset. The onset of symptoms is a big clue. Okay, so frozen shoulder pain typically creeps up on you slowly, while rotator cuff pain can either come on suddenly or develop gradually over time. Two, pain location. So frozen shoulder pain tends to spread all over the shoulder joint, whereas rotator cuff pain is usually concentrated in the front or side of your shoulder. Okay? 3. Range of motion. Both will limit your ability to move your shoulder, but frozen shoulder in the other hand causes a much more significant loss of movement. Okay? Number 4. Imaging findings. Frozen shoulder shows a thickened shoulder capsule or scans, while rotator cuff injuries reveal tears or inflammation in the tendons. Okay, so these are basic differences between frozen shoulder and rotator cuff injuries. Okay, now let's take a look at the key differences in treatment approach. While both conditions affect shoulder movement, their treatments differ significantly. All right. Now, for example, rotator cuff tear or injury treatment aims at strengthening the shoulder and possibly repairing torn tendons, whereas frozen shoulder, in the other hand, focuses on restoring mobility through stretching, physiotherapy programs, and sometimes medical intervention like hydrodilation or manipulation under anesthesia. All right, treatment options for frozen shoulder and rotator cuff injury or tear. How then are these shoulder conditions treated? In case you're suffering from shoulder pain, pay attention. I'm telling you this for free. Okay? Well, the treatment options for both frozen shoulder and rotator cuff tear are quite vast, ranging from non-surgical to surgical treatments. So the non-surgical treatment options include 1. Physiotherapy, 2. Medication or the use of drugs, 3. Corticosteroid injections, okay, 4. Platelet-rich plasma, that is PRP, 5. Nerve stimulation such as the use of TENS, that is transcutaneous electrical nerve stimulation. So these non-surgical therapeutic approaches are often effective in treating these conditions. Okay? You have to discuss this with your physiotherapist or your healthcare provider to know which is the best for you. Recovery tips and prevention strategies. I'll tell you for free. Following recovery tips and preventive strategies, okay, becomes equally important once treatment begins. So here are some tips for recovering from frozen shoulder and rotator cuff injuries. 1. Proper rest and allowing the shoulder to heal are vital. Okay. Number 2. Physical therapy or physiotherapy program that is tailored to conditions specific to your individual needs and goals. Okay. 3. Using ice packs or heat pads on the shoulder can reduce pain and swelling during recovery. Okay. Number 4. Engaging in activities that strengthen your shoulder muscles. This can help protect against future frozen shoulder or rotator cuff injuries. Number 5, regular shoulder exercises and stretches can maintain range of motion and flexibility, hence preventing stiffness and injury. Okay, number 6, taking frequent breaks during repetitive or prolonged overhead activities can reduce the risk of rotator cuff injuries. Okay, here are some home remedies to try. So beyond professional treatment, some home remedies can also aid in managing these conditions. Okay, so here are a few remedies to consider for free. 1, applying heat can help loosen tight muscles and joints. Okay. 2, icing the affected area can reduce swelling and joint stiffness. Okay. 3, for individuals or you experiencing frozen shoulders, supplementing with vitamin D can be beneficial. Okay. And also the use of tense therapy can also help you. All right. Number 4, gentle exercises and over-the-counter pain reliever can also serve as effective home remedies for the treatment of frozen shoulder. Although in most cases you don't need drugs, physiotherapy alone can address this issue. All right. Now, here's the next steps for your shoulder healing and recovery. In case or if you are living with shoulder pain or know someone that has shoulder pain, it's crucial to seek a proper diagnosis from a medical professional, whether it's a rotator cuff injury or a frozen shoulder. It's important to have a tailored treatment plan for your road to recovery. Subscribe to my YouTube channel at Panacea Clinic Programs. I remain your favorite online physiotherapist, Chinedu Obai. Follow for more updates until I come your way next time. Bye bye.